Its findings can only be described as truly shocking. The panel found that over the period, the lives of over 450 patients were shortened by clinically inappropriate use of opioid analgesics, with an additional 200 lives also likely to have been shortened if missing medical records are taken into account. The first concerns were raised by brave nurse whistleblowers in 1991, but then systematically ignored. Families first raised concerns in 1998, and they too were ignored. In short, there was a catalogue of failings by the local NHS, Hampshire Constabulary, the GMC, the NMC, the coroners, and as steward of the system, the Department of Health. Nothing I say today will lessen the anguish and pain of families who have campaigned for 20 years for justice after the loss of a loved one. But I can, at least on behalf of the government and the NHS, apologise for what happened and what they have been through. Had the establishment listened when junior NHS staff spoke out, had the establishment listened when ordinary families raised concerns instead of treating them as troublemakers, many of those deaths would not have happened. I also want to pay tribute to those families for their courage and determination to find the truth. I want to reassure the public that important changes have taken place since these events, which would make the catalogue of failures listed in the report less likely. These include the work of the CQC as an independent inspectorate with a strong focus on patient safety, the introduction of the duty of candour, the Learning from Deaths programme, and the establishment of medical examiners across NHS hospitals from next April. Families will also want to know what happens next, and I hope that they and honourable members will understand the need to avoid making any statement that could prejudice the pursuit of justice. The police, working with the CPS and clinicians as necessary, will now carefully examine the new material in the report before determining their next steps, and in particular, whether criminal charges should now be brought. In my own mind, I am clear that any further action by the relevant criminal justice and health authorities must be thorough, transparent, and independent of any organisation that may have an institutional vested interest in the outcome. For that reason, Hampshire Constabulary will want to consider carefully whether further police investigations should be undertaken by another police force. And I intend to meet as many of the families as I can before we give our detailed response in the autumn. I'm also delighted that Bishop James Jones has agreed to continue to provide a link to the families and lead a meeting with them in October to allow them to understand progress on the agenda and any further processes that follow the report.